And away we go. So welcome everybody to our Connected Conversation series. This is actually the first of what we are returning. We did a Connected Conversation series, a monthly webinar back during the start of the global pandemic in order to keep people connected to the thoughts, ideas, and people that would help them get through the global pandemic. And we're kicking this year's off and also the ongoing Connected Conversation series with Dr. Kiffer Card and the results from the 2022 Canadian Social Connection Survey. It's great to have so many people here. We had 40 people signed up, as I say, and just excited to see old faces, new faces, and lots of people interested in what we're talking about today. For those who don't know me, my name is Pete Bombaci. I'm the founder of the GenWell Project. We're a Canadian not-for-profit that since 2016 has been working to educate, empower, and catalyze Canadians around the importance of face-to-face social connection for our happiness, our health, our longevity, and the betterment of society. We do this each and every day, and we have for 6 years by giving tips, tools, ideas, and research on our social media channels and on our website. And then we have a series of activities throughout the course of the year focused on different aspects of society, whether it's youth, seniors, or, connecting through family, friends, neighbors, classmates, or colleagues that happen throughout the course of the year in order to catalyze Canadians to take action. We are a social health movement, and we start by educating, then we empower, and then hopefully we can catalyze people around this important action that most of us were never educated on, but we need to know this information more than ever before right now. Our next occasion, just in case anybody's interested in joining us for that, is GenWell Weekend, which is coming up on May 5th, 6th, 7th. We'll be launching a campaign April 3rd for a 5-week campaign to inspire 38 million Canadians to get connected on GenWell Weekend. And we hope you'll join us by making your plans to get connected to 1 or 100 people, doing whatever feels right to you, and registering your intention at genwellproject.org, because that's how we make the world a happier and healthier place, one face-to-face conversation at a time. Before we get started today, I'd like to read a land acknowledgement. This land acknowledgement was created by an intern that worked for GenWell a couple of years ago, and I'm very connected to it. I believe it's a really great expression of how we at GenWell feel about acknowledging what has happened in our past. We acknowledge that the land we're meeting on today is the traditional, ancestral, and unceded territory of many nations. In Toronto, that includes the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Seneca, the Haudenosaunee, and the Wendat people, and is now home to many diverse First Nations, Inuit, and Métis people. We acknowledge that Toronto is covered by Treaty 13 with the Mississaugas of the Credit and is within the lands protected by the Dish with One Spoon Wampum Agreement between the Haudenosaunee and the Anishinaabe and applied nations to peacefully share and care for the resources around the Great Lakes. We are grateful for the opportunity to work on this land. In the spirit of the GenWell Project, of the Human Connection Movement, we know that this agreement is not enough, and we encourage all that are here today to go beyond, to reflect and add, and to act on building empathy and compassion through human connection. In order to support Canadian communities, we must first support our Indigenous peoples, and there are many ways to do so. Consider educating yourself about the true history of Indigenous peoples in our country through survivor stories, supporting Indigenous artists, businesses, and communities, or donating to grassroots organizations that support Indigenous communities. Before I introduce our speaker today, I want to highlight that although the GenWell Project has been working to educate and empower and catalyze Canadians since 2016, sometimes it takes a crisis for us all to be awakened to the importance of social connection, or to any type of reality. The global pandemic is what has created the great interest in the importance of social connection and social health. And in the famous words of Winston Churchill, never let a good crisis go to waste. I hope what you hear today from Dr. Kiffer Card, I hope you'll take it, I hope you'll share it, and I hope you will become part of the Human Connection Movement, because that's how we create a world in which we build more empathy and compassion for one another through greater human connection. The format for today's webinar will be conversational. I've had a chance to look through the slides, had a quick chat with Kiffer, and the reality is there's a lot of information here that I'm quite sure people will be interested in diving into. So rather than creating a log jam at the end of the conversation, we're going to try to take questions along the way and give Kiffer an opportunity to respond to them as we go through some of the deep insights. We got 90 minutes booked on the Zoom, but at the 1 hour mark, we'll try to wrap it up and we'll record the whole thing. So hopefully if there's any questions that you missed or wanted to get in, we'll try to answer them and you can come back and catch the recording later. So now I get to introduce our featured presenter for the day, Dr. Kiffer Card. Dr. Card is a social and behavioral epidemiologist and professor within the Faculty of Health Sciences at Simon Fraser University, where he studies the social and ecological determinants of emotional distress. In addition to this role, Dr. Card is the research director of the GenWell Project and the executive director of the Canadian Alliance for Social Connection and Health. In these roles, he serves as principal investigator for the Canadian Social Connection Survey and oversees the development of the world's first guidelines for social health. How about that one? The Canadian Social Connection Guidelines. Today, I'll discuss the preliminary findings related to these projects. Funny enough, Kiffer and I have actually never met in person, and for 2 years, I've had the incredible and distinct pleasure of working with Dr. Kiffer Card. His ability to express the information that he will from the insights today is really amazing because he can keep it at a level where it's easy for people to understand. And so without further ado, I'm going to pass it over to Dr. Card and let us get started on understanding the results of the Canadian 2022 Social Connection Survey. Kiffer, over to you, my friend.
Thanks, Pete, and great to join you this morning. And I know it's noon there, but for me, this is my first meeting of the day, so don't mind me if I'm drinking coffee as I go throughout, just to keep awake. Not that this content isn't exciting. Hopefully, you'll find it really interesting. Some of the material is from our Canadian Human Connection Conference, which hope you were able to join. But a lot of these analyses, as you know, are moving along, and so we've really added quite a bit of depth to the analyses and to the work here to really understand what the impact of social health is and what we can do to address it. And so I want to start with this, and you can post in your chat your answer to the questions, or otherwise let it be known. But when we think about social health as like a motivation for why we study it and why me as a public health person care about emotions and loneliness and social connection in the first place, where would you rank loneliness and social isolation in terms of their impact? If you were to guess, like between high blood pressure and poverty, or between air pollution, sedentary living, so on and so forth, where would you maybe rate loneliness in terms of its impact on health? Okay, so blood pressure and poverty, says Marilyn. A 1.5, so these are called hazard ratios, and so that's just like the ratio of added risk if you're lonely versus, or if you're, smoke or don't smoke. Okay, so we've got a few people in, and hopefully you've got a number in your mind as well. And I think this study from Pantel in 2013, so we've known for more than a decade that elements of social connection are more important than your blood pressure, your poverty, your obesity, whether or not you live in a place with high air pollution, whether or not you have a sedentary or active lifestyle, that these factors are really critical to your physical health, and the way that your environment, social and ecological, get into your skin is really what drives me to motivate. In fact, in terms of preventable risk factors, only cigarette use, only smoking has a greater hazard ratio on early mortality. And so, that's pretty significant in terms of your added risk. And this has been replicated in multiple reviews by Julian Holt-Lundstad, by the Living Systematic Review that my team has conducted, with more than 130 studies up to 2022. So these are robust findings that come from longitudinal studies across the entire life course in some cases. And so it's a pretty profound impact. And if we think about why we see such a strong association between loneliness and morbidity and mortality, it's important to recognize that this affects and touches on almost every aspect of life. That your ability and having healthy relationships really has cascading consequences if you don't have those relationships. So first, of course, you can have chronic health issues that cause you to be more lonely. If you have mobility issues, have a hard time getting in the house, that can create loneliness. And so that gives rise to part of this association that we see. You're exposed to more stress in life. If you're single, live alone, then you have greater financial burden. You have more wear and tear due to chronic stress response. Is what we see is what happens to a lonely or isolated people is they become what we call vigilant. They become hyper vigilant. And that just means that they are always on alert, always, and their stress in their body reflects that. And so their biological stress response is kind of always at a heightened state of activation. And this really hurts the heart and other bodily systems through inflammation and poor immune response and so forth. Then there's unhealthy risk behaviors. Because you're lonely, you cope. And so you might eat more unhealthy foods. You might not get out and exercise. And so that also has a lot of problems. And the list goes on, absence of positive peer influences. So I think that really is what we're seeing in the data is that there are many, many reasons to address social health as a key determinant of all the other types of health that we're considering, physical health and so forth. And so that's really the motivation behind the Canadian Social Connection Survey, which Pete and I, originally started off really just the side of our desks in the wake of the COVID-19 pandemic with very little funding, but we were able to eventually get the support of the Public Health Agency of Canada, the Canadian Institute for Health Research, the Social Sciences Humanities Research Council, to fund this long-term study to monitor how we are recovering our social health in the wake of COVID-19, both through a cross-sectional study and then a longitudinal subcohort. So some of the participants who participated in our first cross-section are now being followed, and we hope to follow them for years. As long as we can keep funding in the door, we'll follow these people across their lives, hopefully, to see how they're being impacted by their relationships. So this question about how common is loneliness and social isolation is a great one because there are kind of different times. And these are the first kind of data. So if you have questions, go ahead and throw them in the chat, Pete. We can kind of chime in back and forth. But is what we see from the Canadian Social Connection Survey, and I'll just give a high level finding of what the graphs say, and then answer any questions about them. The first thing is we see that about 43.5% of people are lonely. And about half of those experience lonely on an ongoing continual basis. And I think this is important because many of us feel lonely transiently, and then some of us feel lonely chronically. And we really think that chronic loneliness is what drives a lot of the negative health impact. So if you think about half of people who are lonely are chronically lonely, and about half of people overall are lonely. So that's something like a quarter of people experience kind of this chronic level of loneliness. And if that doesn't describe you, if you don't feel like, oh, I'm not chronically lonely, 70% of us report knowing somebody who is. So this is an issue for all of us to be concerned about because either you or someone you know is likely experiencing chronic loneliness. Any thoughts on that, Pete?
No, just the size of this and the comments, as it being self-reported, I believe there's still a lot of people who may not self-identify as lonely because, that certainly comes with some negative connotations. But I will even say that after 5-6 years of running the GenWell Project, I can now identify times in my life when I was lonely that I would never have identified it as lonely previously. So I think we are just starting to understand what loneliness truly is.
Yeah, and one of the few prevalence studies ever conducted in Canada to really kind of understand the extent of this was the Angus Reid survey that came out right before COVID-19 hit in 2018, 2019 was their data collection period. And they found only 22% of Canadians were optimally healthy when it came to their social relationships. They were embedded and thriving in healthy communities. And to me, that's like a startling, this is most of us. And so but I agree that you're right, that even though most of us struggle, I think that there is stigma. There's been several papers written about the stigma of loneliness, and that does make measurement difficult, and something we try to overcome in our survey through the use of these validated measures that try to get around, directly calling it lonely. People might be willing to admit to feeling disconnected or feeling left out or something, but lonely, I think, carries a lot of stigma with it. You're right. So this chart, the 4 charts here, these are box plots that show in the cohort. So among the people we've been following, looking within person, how have these people, about 500 or so people, changed with regards to their level of loneliness from just after the COVID-19 pandemic lockdowns? And that was right between the second wave and the third wave. Ontario brought back their lockdowns immediately after our survey. But so if you look at kind of that in-between time of just like loosening restrictions and lockdowns immediately following the pandemic, and then 1 year later, in the summer of 2022, you can see that across these measures, the measures identified along the left-hand side, UCLA loneliness scale, the De Zonge social loneliness scale, and emotional loneliness scale. Social loneliness is, I don't have a lot of social attachments. I don't have big social network. I'm feeling left out of a broader community. And emotional loneliness is, I'm missing those really deep, intimate, personal relationships that I need. And then this last one is Pinel existential isolation. With that's like how cued in and connected do you feel to the people around you? And just what we've seen is that there's been modest changes. If you look at this bar in the middle, that's the average level. And then the box captures, most of the data is a good way to kind of think about these plots. And so you can kind of see that there has been a shift in that most of the data is shifting down, but the average actual level or the median level of loneliness is actually the same between these 2 time periods. People are shifting a lot, but not like tremendous amounts. And I think that's reflected from the Angus Reid data that I mentioned, is that, we had a lot of social disconnection before the pandemic. So we don't expect the pandemic to change things a whole lot. When it comes to social loneliness, how socially disconnected from our broader networks, those distributions look pretty similar to me. And in fact, they're not statistically different. When it comes to emotional loneliness, so that lacking emotionally close ties, it is lower. You've had a lot of people shift downwards in response to the COVID loosening up, but the median level is still about the same. And then when it comes to existential isolation, we actually seen a statistically significant increase. People feel more disconnected, like culturally and socially from others. During that time period. And that may be because of the political and social tensions, that have emerged in the past year or so. And so, I think this captures my overall assessment is, there's been some shifts, but remarkably similar levels across the pandemic. And so I think Pete's right. You said that, the pandemic has woken us up to this, but I think this is a problem that doesn't seem to be going away quickly. I'll just jump into this next slide as well, because I think this is an interesting way to kind of look at this in terms of its relationship to social connection. So if we think that immediately past the 2021 period versus the 2022 period, here we chart the trends for the 2021 cross-sectional survey and the 2022 cross-sectional survey, and then also for the cohorts. So we split out those cohort people to see, okay, is within person variance versus kind of between person. So the 2 orange lines, basically you can interpret those as those 2022 people. And the green line is 2021. And what you actually see is that maybe in the wake of the COVID pandemic, we were more socially connected in some ways because we had the time, the energy, the attention, and we all were woken up by how disconnected we were, that we went out and got connected. But you actually see that a lot of factors were more common actually in 2021. So going on a walk with somebody, helping a neighbor out, making a new friend, video chats, not group meetings, intimacy, participate in online forums, volunteering in the community, going to church, group exercise, game nights. Those are things that were actually more common. And then in 2022, we did, rebound in some ways. We're greeting our neighbors more, we're visiting with friends, visiting with family, the lockdowns are gone. But we're going out to eat and drink, checking on someone. So those pandemic restrictions do seem to have lessened a bit. And in some ways we've improved our social connection, but overall, I think the message here is that, we've don't have the time or priority to invest in our social health. And that might be some of the reason that some of these changes were just very moderate, is because we have not persistently improved in our social connections. Any thoughts on that, Pete?
Yeah, Kiffer, we've got a question from Elena, which is curious to learn your thoughts about social avoidance versus social isolation. I know you have stats. I don't think they're in the pages today, but the percentage of the population that is identifying as introverted, shy, socially anxious. I think in July, it was still 30% of people that were fearful of COVID. So there's lots of reasons why people are, not yet reconnecting. Maybe you can touch on that a little bit.
Yeah, I think we do have slides on the barriers. And,
okay.
and I think like you identified one, in that like people in some ways are fearful of social, social connection in the wake of COVID-19. Many people are still worried. I think particularly seniors and people who, live with disabilities that make them more vulnerable in particular. So I think that those are a really good point. Elena, would you like to, I just want to know what you mean by the term social avoidance versus social isolation. I think I get what you mean, but I'm not 100% sure what what distinction you're
Go ahead, Elena.
Yeah, it's good to see you, Pete. Elena from TELUS here. I'm on Janet's team. Kiffer, nice to meet you. Basically, I've been doing a lot of research, and I do see the whole concept around social avoidance. Like, people are avoiding people, and whether it be in the workplace setting or even just personal relationships. It's not that people are having a hard time trusting people, but maybe people are, to your point, not wanting to invest the time. But I guess my question is why. So I just wanted to get a sense of what your thoughts were around the notion of social avoidance versus all this amazing research that you're presenting on isolation.
Yeah, that's really great. And I think a lot of this is captured in that. And that, like, I think something Pete mentioned that always resonates with me is that we have never been taught or educated the importance of relationships to our health. Everybody here knows that they should eat their fruits and veggies. They should avoid the added sugars. They should avoid the saturated fats. And everybody knows that we should get something like 30 minutes of exercise, per day, moderate physical activity. But we've never really been educated of the importance of social connection. Knowing what we know now and what we've learned over the past 2 or 3 decades is that it's very destructive to your health. And I think if people understood that and thought of their relationships in a holistic way, then I think they would be much less avoidant, because our preferences aren't just preferences. They come from somewhere, and they come from the values and the priorities that society tells us we should invest in and we should behave in, the ways we should behave. And I think that for a long time, the narrative over the past maybe 5 years or so has emerged that, maybe people aren't so great. There's a lot of political divides. There's a lot of people not to like. And I think really our culture in the digital era has really been, such that it really primes people to want to avoid interacting with others. And I think that that's a big, social problem that we've got to invest in. There's been, for example, you're from TELUS. I don't know what division you work in, but, I think there's Robin Dunbar is really famous for this work around telephone surveys. There's a really interesting way of just looking at call durations and the ways that people on their phones, connect with other, and the patterns of gender and age and all those sort of things that influence how and why people connect. And I think that's, I think it has some really important lessons about that. We have actually been declining and like that kind of face-to-face and personal connection over time. And I think what you're describing is part of this long-run trend and change in our culture.
And I'll just chime in there, Kiffer, because I know Dr. Steve Jordans, who's another one of our scientific advisors, has also talked about habits and rituals. Most of us were out and about on a daily basis, whether it was heading to the office, the gym, the grocery store. And we've created some habits over 2.5 years, and we all can relate to what it's like going back to the gym after not going to the gym for 2.5 or 3 years. And it's not so easy. And so, as we see, and Kiffer will talk about all the ways in which people are self-identifying as I don't feel as comfortable going out and doing things, that you can start to see the barriers of people getting back out and heading to a coffee meeting instead of on Zoom, which a study a month ago said there's 9 times the brain activity in a face-to-face meeting versus a Zoom meeting. So we need to realize we can't replace human connection with Zoom. That will not, result in long-term benefit to people. But I think it's really about us all recognizing that we're part of the solution by stepping up and, highlighting for people, hey, let's go have a coffee. Let's spend that time face to face, because there will be some people who've created those habits and rituals, like staying in the pajamas all day, like never having to leave their basement. And I'm guilty of it myself at times. And so, the reality is it's not easy, but we need to help people get back to it because we know the longer term implications to their health and well-being.
There's actually been studies in which you can induce avoidant behavior. And I think that connects back to I was talking about how lonely people become more vigilant. If you think about loneliness and why it evolved inside of us, historically, when we lived in savannas and we lived in small tribes, if you become separated from your tribe, you have to be on high alert. You have to look around, which means you don't trust people you don't know. You don't trust the environment that you're in, and you stay vigilant because being alone in that environment is very dangerous. And so we can actually do studies, and they've done studies where they isolate, college students, for example, and, not even for very long periods of time, on the order of hours. And they actually see that even over that small amount of isolation time, people become more avoidant. And what do avoidant people do? What do vigilant people do? They avoid social interactions because they feel stressed. And they're like, I need to invest in me. I need to keep the resources inward. I can't trust other people. And if that can be induced in the space of a couple hours, what do we think things like pandemic lockdowns have the potential effect to do, right? It's this potential to create a really high level of vigilance. And I think that's part of what we've really got to address, as we kind of think about how we're connecting with one another. I think the other thing about common digital tools, I think in the digital era, we've definitely seen a compounding of this problem, but it's all about how you use those tools, right? It's not the tools in of themselves. This webinar, for example, wouldn't be possible. There wouldn't be ability for us to connect like this. Pete and I would never have worked together if it weren't for Zoom and, these digital technologies. But it's like, do we use our technologies to connect with one another, or do we use them to kind of passively engage? And I think that's the really big challenge. And I think connecting to this idea that you bring up is actually, leads well into our next slide. It's that there is a difference between how much social connection people want and how much they get. And as what we generally see is that people are actually, pretty good at getting the level of social connection. The light color here is the ideally how many people would you interact with. And the orange is how many people they actually interact with in the past 3 months. And so what you can kind of see is that people generally want more time, particularly with friends and family and other people. They want to spend more time in those sort of connections than they're currently getting. But overall, these are not like gigantic differences. Most people are able to effectively get these social connections that they want and need. And then we also have this in terms of the amount of time that you spend with people. Most of us are able to get the time connecting with acquaintances, neighbors, and coworkers. But then when it actually comes to, getting time with friends and family, quality social time, that's where I think we're feeling some gaps. And that's, maybe, behind some of this effect of loneliness. And then just one more slide on this preferences piece. Is the actual and desired prioritization of social activities. And you can see, again, I think most people feel like their priorities are pretty strongly aligned with what they're experiencing. All of this to say is with the one qualification of is that people aren't always great at forecasting for themselves what will bring them benefits. We know this from hundreds of psychological studies that people tend to underestimate certain positive things in their life, like social connection, and they overestimate the costs of those things to themselves. And also a lot of that's shaped by our values of society. And so if you think that, you should be prioritizing family time, for example, you do a pretty good job of prioritizing it. So this difference between our actual and desired prioritization is all confounded by what we teach and what our culture says our values should be. And so I think that's really important across all three of these slides. But do you have any questions, Pete, on that aspect?
Not on that. I think the one thing is actually your last comment I think is so true, is the area that we focus our relationships are the ones that we have somewhat been educated on, which is, hey, you need to build family and friends. But I think, you know, when in our 2021 survey, we saw that time with workplace colleagues had as important an impact on happiness as time with friends and family, and also an impact on reduced loneliness. And yet I think most of us look at going back to the office as a terrible thing, or at least building relationships with our colleagues as like, why do I need that? And the reality is, if you're going to spend 8, 10, 12 hours working on something, there's a huge benefit to having connections with your colleagues that you spend time with. And that's not a, I need everybody to go back to the office message, but that's an important message for our employees to understand, hey, we all get benefits, including the business, but we all get benefits out of these things. And as you know, we've done a lot of work recently on strangers with Dr. Gillian Sandstrom out of the UK. We've been telling people for 50 years, don't talk to strangers. And I would highlight, there's a ton of benefits, and they might be the gap filler right now at a time when we're not out in the office and the gym or the grocery store, that talking to strangers with an eye contact or a smile or a hello may be one of the greatest things we can all be encouraging people to do as we come out of the global pandemic. I'll get you a comment on that, Kiffer, but there was one question from Stephen Ayer here, who might be a researcher. Sorry, Stephen, I don't have the background there, but he was just asking if was there any sampling strategy change between 2021 and 2022?
Nope, we've used the same serial cross-sectional sampling strategy, but this is also why we study both the longitudinal cohort and the serial cross-sectional study, because we really want to make sure that the data we're finding is both happening within a person, that these are actually changes that are occurring at the person level, and not just simply attributable to the snapshot you take. And of course, that's a limitation of cross-sectional studies, is you're taking a snapshot, you're just capturing what the population might look like at a given moment. And of course, you never know. There could be a million different confounders into any different study in terms of who ends up in your sample and why they end up there and how they're participating. But to control for that, really, we relied most on this within-person data for our longitudinal cohort, so we can really understand how our individuals changing and how our population's changing. I think one thing that I think you said, Pete, is just the strangers, and I think it is a good point that strangers were the lowest category, and I think it is connected, like you said, that our culture matters in terms of how we perceive these relationships, and the cultural category of a coworker versus a friend is really artificial. Now, that's not to say that there's not reasons. Lots of workplaces don't value social relationships and interactions between their employees, and even some might outright discourage it. But I think that's the important thing to remember, is these are just social constructions of ideas, and you can have a close, meaningful relationship with a neighbor, a friend, a coworker. You can develop those relationships in whatever setting that you meet people. And I think we have some data on that later about where people meet others in their lives. Okay, so I'm just going to move on quickly to get to some of this interesting data about that. We've looked out, and this is actually from the 2021 survey, but I think it drives home an important message, is that we looked at just the millennials in our sample, and we looked at how many friends they reported in elementary school, junior high, high school, and then at the present day, just for the millennials. And it's what you kind of see is that our social networks are really stable. And in fact, if you look at the change in the numbers of friends, most people who change, go from none, end up just going from 1 or 2 friends. They don't leapfrog from going to no friends to 5+ friends, right? So our social lives and the ways that we're taught to relate to one another are incredibly durable over the life course. And we see that if you're lonely as a young kid, you're lonely in your middle age, you'll be lonely as a senior. And so really it highlights that when we think of morbidity and mortality, the impact on health, most research today is focused only on seniors. Most work around loneliness and social isolation targets that population. But if we want to have a real population impact, if we want to reduce the effect of that cumulative daily stress that loneliness causes on your heart, on other physiological systems, then we really need to be intervening earlier in life and really building those intergenerational connections to help for everyone, not just seniors, address these issues if we actually want to reduce mortality and morbidity eventually in seniors. In particular, I think middle age is this group that is often ignored, in that we're pretty good at having youth and mental health programming that addresses things like social connection. We're pretty good with trying to get social isolation and loneliness in seniors, though I think there's still a lot of work to be done there. But in middle age, it's kind of this forgotten population. And you see that amongst Gen Xers, for example, 1 in 5 people report that they have no close friends in our 2021 data. And compared to Gen Z, for example, the people who are currently in school, none of them reported that they have no close friends. And I think that's because they're surrounded by potential friend mates. But as you get older in life, you start withdrawing from those environments in which you could make meaningful social relationships. And so I think that this age effect is something that we really started to look at when we look at things like social support and time with others and loneliness. And you definitely see that there are patterns that are similar across genders. So for men and women are the red and blue lines, and then green is for non-binary folk. The non-binary folk, I'll say that our sample sizes are quite small there because they make up about 1% of the population. So in a sample of 2,000, it's only 20 or so people. So these lines, you can see in the light gray, these very large confidence intervals, and that, we really don't know what's going on. We will probably develop out research to particularly look at some of those, issues. But for men and women in general, they have remarkably similar patterns. The confidence intervals overlap, so those aren't really statistically all that different over the life course. But we see that really our social support in our 30s and 40s, when you have family, is great. Late 50s, by increased levels of divorce, partners dying, those sorts of things can cause separation. And then at the end in our data, partly due to sparse data, but also potentially due to survival effects, and that the very old tend to be, if you make it to 90, it's probably because you're very well socially supported and connected with others. If you don't make it to 90, you died back when you were 70 or 80, well, it's because you were missing kind of those social connections. And that's why we see that in the data that, morbidity and mortality are so closely related. This is social support from family and social support from friends. You see that the family during childbearing years, for example, is much higher in general. But overall, these are the patterns over the course of the life. It differs from the time that you're spending with others. I think social support and the time you spend, that objective and perceived feelings are different. We see that people over the course of their life, men and women, spend less and less time socializing with friends. We kind of describe this in the literature as like a pruning of your social network. You start to invest on those relationships that you find most important, and that's oftentimes your family. Family trends are kind of stable over the course, but there are slight declines. As children move away, as families move away, you start to see a dissolution. So that again contributes to amongst seniors, elevated rates. But I think the one that I wanted to call attention to is this acquaintances group, because our acquaintances and our friends are from whom we pull in new people to connect with. And you see that really in those first few decades, from age 20 to 40, you see a steep declining. We really cut ourselves off from this opportunity to connect with acquaintances, strangers, other people. And I think that's a big problem in middle age, is you no longer have a pool of people from which you can draw friends. And so that's a really critical challenge. And in fact, we looked at where you meet your close friends. And we see that most of your close friends were met through school, through other friends, so friends of friends, or through work. And then you start to see, like, go to a club and organization, people in your neighborhood, lesser extent online, coffee shop and restaurant. That those maybe online might increase over time as more people use like Bumble, BFF. The other thing we looked at is how long you had known your close friends. And I really like this saying, is just a thing to push people to do, is to connect with their old friends, because you can't make an old friend. And in fact, if you're going to pull from a friendship, it's somebody that maybe you've lost contact with that you might be able to reignite that relationship with as an easy way to connect. Because for sure, our close friends are people that we've known for longer time. And then I'll just throw one more in here before we go into any conversation about any of these. But loneliness by age and gender, you really see for emotional loneliness, so that lacking close friend, again, a constant decline over the course of a lifetime in loneliness. People seem to need social connections left need them less to have their social well-being met. Young people are the people who really have the highest levels of emotional loneliness. And then middle-aged and young seniors are those who have the highest levels of social loneliness. And again, why do we do okay in social when we're young? It's because we're surrounded by people in school and work and that sort of thing. But as you start to get isolated in midlife, that's where you start to see these kind of increases in kind of social loneliness. And so those are the trends across age and gender. High-level takeaways is it's broadly similar by gender, but with important differences as you age that have to really do with your life circumstance, that where you are and how you are in life really is shaping that social well-being for you.
Great stuff, Kiffer. Certainly, if I reflect back to some of your earlier comments in that segment, one of them about we have some interventions for young people and seniors. And certainly, if you look at the start of the global pandemic, we went to seniors first because we had a crisis happening there. I think a lot of the times, both in the past and even at the present time, we focus on the crisis of helping people that are lonely today or in crisis today. And I think there's a big opportunity as you look at the facts and you look at the information you're sharing to really educate the broader population, because social health, unlike mental health and physical health, mental health, we've taught people to journal, mindfulness, gratitude, breathing techniques, a lot of things. We've really empowered people to take care of themselves or make changes in their life. Physical health, go for a walk, a run, a bike, a hike, whatever it is. Social health can't be done alone. And a lot of times we say, let's teach the seniors to be more social. Well, actually, maybe part of the solution is actually educating the broader population to say, hey, do you know a senior? Do you know a young person? Eric's chimed in a couple times in the last one just on digital health there is, if a young person is struggling with digital, what can we do as an aunt, an uncle, a neighbor, a friend, a brother, a sister, a father, a mother? We are all part of the solution of a disconnected world and improving people's social health. So I think what's really powerful here is the understanding, is the knowledge that people can actually start to look at situations with their families, friends, neighbors, classmates, colleagues, whomever it might be, and say, I see what's going on here. I can be part of the solution. Let me reach out. And I think that's what I take away from, this whole age and stage of life that we all go through. And so recognizing that it's a normal thing and that, again, we're a human connection movement, not a loneliness campaign. We're focusing on the positive and the solution, and each one of us can be part of that solution.
Yeah, Pete, I agree completely. I think one of the things, even being working with this data, it's an incredible honor, for these thousands of people to have told us about their lives by taking our surveys. But, looking at these charts, it wakens up in me to think not about just what's going on in these people's lives and the data that I've got, but also, thinking about like trying to be empathetic and think about the lives of people in my life and think like, oh, so-and-so, is divorced, or so-and-so is, they're probably experiencing, like there's a high degree of probability they're experiencing some of this distress. And what am I doing to do that? And I think that when you start looking outwards, I think that's really a lot of the goals. If we can get ourselves to look outwards, that's really good for your mental health. It's really good for your social well-being, economic well-being. Even we see that people who tend to be more generative, tend to end up really, much better off. And so I think these are really important, lessons, I guess, just to how you live your life, stepping back from the data for a moment and just thinking, are you the kind of person who is generous with your time and energy to make sure that those people around you are healthy? And I think that like leads into this next segment pretty well of like, what do we do about all this? Because it is pretty like, as we've talked about, there's all this external pressure really driving people's lives and what they do. If you work, you're getting disconnected because your workplace isn't very hospitable to social connection, and you're separated from your family because you've got to work 40 hours a week, and then you're tired when you're home, right? These are like, I think, things that are very like just ingrained, they're facts of our society, and how do we get around that? And so that's been a real big part of our developing out these Canadian social connection guidelines of figuring out what we can do as a society to really address these things. And so the first thing that we did is we asked about something like 33 different social behaviors. And we wanted to know, what are those behaviors and things that have the strongest effect on reducing loneliness? And so within our cohort and within our cross-sectional survey, this is based on our cohort, I believe, we looked at like, if a person changed how much they talk to somebody, so they increased the frequency, how much of an effect would that have on their level of loneliness? And so we looked at the lower odds, so how much lower odds of being lonely for each 1 point increase in frequency. And the frequencies here was like on a 7-point scale from, it was like daily or multiple times a day, all the way back to like, not in the past 3 months. And so if people increase for each, 1 point increase in frequency, the most high impacting activities, which we defined as reducing the odds by 50 to 75% of feeling lonely, was talking about hobbies, board games, talking to someone about their day, their family, greeting. The thing that strikes me about all these 3 things are things you can do really with anyone, and they're things you can do for free. So they're really good in terms of there's not a lot of barriers to doing them, except for the barriers that come from within. And so it's just talking, greeting, saying hello, being a good person. The next ones from 25 to 49%, so these were moderately effective things that you can do, is go out, make a new friend, go out for coffee, talk to someone, kiss someone, go for a walk, phone conversations, hugging, visiting with friends in their home, visiting with family, attending meetings at work, write a personal letter with friends or family. So those were moderately effective at reducing. Those that had a small impact, I guess, on loneliness were things that were mostly digital. So you're playing online games, you're having extended conversation via text or message app, you're video chatting, and you're perceiving. So again, they have effects on your loneliness, and they're largely positive for you, but they're definitely not as good as those in-person activities that we saw. But maybe that's all that's accessible to you, so maybe that is what you should be doing. And then the things that actually didn't have a significant effect were, doing a task or chore, video chatting, text messages just to check in, volunteering in community, attending church. These were very small effects that were not statistically significant. So we really can't say to what extent they improve your health. But I think nonetheless, none of them were negative. None of them hurt you. And so if that's all you can do, if that's all you have access to, maybe it's just about being more intentional. When you go to church, are you connecting with other people as well? Are you staying after for that coffee? Are you doing those things to really get the most out of these activities? And my sense is that a lot of people miss out on those positive aspects of some of those things because they might just go, participate in a yoga class, but without actually interacting with those people, which can actually be alienating, right? If you're surrounded by people, but not interacting with them, that can really make you give this sense of feeling. So the next thing we did after we said, okay, there's these moderate and there's these strong, moderate and small effects on loneliness. How frequently should we do those things? Like at what level doing that thing has its greatest impact on loneliness, if that makes sense? And so the things that have the greatest effect on your loneliness, if you do them daily, are having conversations with others, greeting, phoning, texting, hugging, kissing, and sex. So do those things daily, then you're going to be great. Also playing video games. And I think I wanted to flag this playing video games one is one that kind of is a bit counterintuitive, because here we say, playing video games is actually a very not effective activity. Like it doesn't, decrease your loneliness that much. And so I think one of the things that we think is going on here is that only when you play daily are you really integrated enough to experience the benefits to loneliness. And so that's what some of these patterns that we see is it might not be the best thing you can do, but when you do it daily, that's when that thing has the greatest effect. So the things that we should do a few times a week are these kind of online video chats, work meetings, getting together with friends. Weekly, meeting for foods and drinks or going for a walk with somebody, a group video chat, visiting family time together. This doesn't, of course, mean that you have to do all of these things. Your social calendar doesn't now have to be full of, okay, I've got to get food or drinks with somebody, I've got to go for a walk with somebody, right? It's about the mix of doing these things, on a weekly basis in which they're most effective. Probably because if you're going out for food and drinks every day, you're probably getting overwhelmed. And so that's the reason that more frequency in some of these activities isn't better, because it costs. It does cost to interact with others. It costs emotional and social energy, and so not all things need to be done on that frequency, at that high frequency. And so this is just the example of, like, on a weekly basis, try to get a coffee date or try to go for a walk with somebody. A few times a month, board games. Bringing people together in your house or going over to somebody's house for some board games. Computer consoles, group exercise, helping friends, letter writing, making new friends, and then monthly community volunteering and non-work related meetings, like a club or organization meeting. And so, so those are the activities that we looked at. Pete, is there anything that stands out to you?
Well, I think there's one statement that you made, and Elena, said great insights here, and I think that's what it was for me. As you know, I had a couple questions on this, but I think you made a statement there that is so critically important. Something is better than nothing. So you may not be able to do all of this, but if there's something on that list that you are more prone to do, that you feel more comfortable to doing, whether that's going and volunteering, even though, at the surface there, I think your comment about people may not look at volunteering as the opportunity to build connection, because we've never educated anybody about the importance of connection, that we may not be taking advantage of some of the opportunities that are around us when we go and do some of those activities. But at the end of the day, something's better than nothing. Wherever it scores there, I think it's clear human connection is what really gives us the greatest value in combating loneliness. And I don't think that's any surprise. And I think the research continues to reinforce it from all different perspectives. And so nothing surprising, but wow, what a great list of activities, which I think is Elena's point, is wow, now we can all look at that list and say, hey, maybe I should do a little more of this or that, or maybe this is something I haven't done in a while, and that might be something I want to add into my schedule or my plan for this week or next.
Yeah, I think you're totally right. It's about, none of these effects, this is descriptive work. This is the way things are, but it's not the way things have to be, right? If we work to change our culture, if we work to invest in, you can make some of these things more high value. Volunteering can be all about social connection and relationships, and probably it would have a much higher effect, and probably more people would engage in volunteering if we approached our, attitudes to it differently, for example.
And I just want to throw one more thing, because I know there's some people on here from the volunteer sector. To me, there's an opportunity to volunteer in a more formal way. But for everybody, there's an opportunity for us to be part of the volunteering movement by talking to your neighbor, by engaging with people that you walk by every day. I think it doesn't always need to be a formal, contract per se, but that each one of us can actually do it from the perspective of making the world a happier and healthier place by saying hello to people, by saying hello to your neighbor, by making the time to connect with a young one or connect with a senior. There's so many ways in which we can give back, which actually makes us happier and healthier, and the people we do it with as well.
Totally. I think that segues nicely into this next slide that I think is really important, that when we think about, how we formulate our social lives, right? The social life you have, the connections you have with people, that influences a lot of your ability to do those other things. If you don't have anyone who who can go out to lunch with you or go on a walk with you, then you're not going on a walk or going out to lunch with somebody. And so so the next few slides are about this idea of, like, structuring and having some goals about your social life and social relationships. And one of the insights that I thought was really important is the more coherent your social group is. So the more that you have one core group of friends in which everybody knows each other and is friends with each other, we see lower levels of loneliness if you kind of have those sort of features, where where you're more coherent. Whereas if it's just one-on-one, where if none of your friends know each other and you're just friends with John and Sue and Nick, then you have much higher levels of loneliness. And so really it's about building our communities and our relationships in a way. And so I think this goes back to what you were saying, is that, like, just like with volunteerism, that we get to choose how our experience of volunteer looks like. That's the same with friendship. You can have friends but still be very lonely, because you're not organizing and making decisions about your friendship in a way that values intimacy and connection and builds structure and lets you have those outlets that you need. And I think one of the things that raises, a question here is like, how many friends do you need? And so this is something we looked at across levels of extrovertedness. And the reason we looked at extrovertedness is we often get pushback on when we start talking about social connection guidelines of people thinking, oh, well, everybody's different and they have their own, emotional needs and that sort of things. Is what we see in the literature is there's actually like remarkable similarity across needs for social health. And in fact, oftentimes we find that more introverted people are more negatively impacted if they don't have a sufficient social relationship. It's true that we see extroverts on average have more friends, overall, but they don't have greater quality of relationships with their friend. All of us seem to have approximately about the same of social energy to expend. Some of us choose to expend it on a few number of people, and some of us choose to expend that on a great number of people. And I think that's reflected in our emotional closeness. But what we see in terms of anxiety, depression, and loneliness is that as people approach, 5 friends, that's really where they see the benefits of adding new friends start to plateau. And so if you were to zoom in here, you see that there's a really steep decline. Going from 0 friends to about 3 friends results in great declines in anxiety, great declines in depression, and great declines in loneliness, up to about 5 friends. And then the patterns pretty much start to even out. And you even see, in some respects, increasing levels of anxiety. There are some differences according to that level of extroverted or introvertedness. But generally, is what you see is they're starting to see increases in depression, anxiety, and loneliness if you have too many friends. And I think that's reflected in that you're not getting those sort of emotionally close relationships that you need. And I think just to underscore this again, we see that as people approach 5 friends, the number of close friends that they have, that effect really seems to plateau in terms of the percent of people who are lonely. And you see that actually the level of loneliness that most people have around three or so friends. But I think astoundingly, if you look here where it's saying, okay, up until 5, you're seeing all those great decreases. Well, 70% of people have fewer than 5 friends. So, vast majority of us can gain something by increasing the number of people that we have a relationship with and connecting out with those people. And then I guess in addition to the number of people, it's also about the time that you spend. When we looked at the amount of social time that people spend with others, kind of a similar thing. As you increase to about 20 hours of social time per week, and that doesn't have to be 20 hours of partying, right? That is 20 hours of having a conversation during lunch. It's 20 hours of, watching a movie together and talking about it. It's 20 hours of, board games and all those sort of things. It doesn't just have to be purely social time, but this is like in the course of your workday, do you have a meeting where you feel like you're getting social time with other people as opposed to just work time? And so, especially on social loneliness, you see this large decrease. The effect on emotional loneliness is slightly smaller, but generally, as we approach that kind of 20 hours, and in fact, is what we kind of see is that comparing, these factors as you approach to kind of 100% of your social need. So if you look at the surplus social time, the red line here is meeting 100% of what you need. So this is about your individual needs. Everybody thinks they need different amounts of time. As you approach that level of having 100% of your social needs met, that's where you see the greatest declines in both emotional and social loneliness. And so it might not be 20 hours for you. Maybe you feel like, oh, I need 6 or 7 hours a week. And that's what we kind of see is that if you're getting your 6 or 7 hours a week, then you're probably pretty well off. And then just the last one in kind of this theme is who should you spend your social time with? And we see that the proportion of your social time that's spent with friends and family versus more distally connected people, coworkers, colleagues, acquaintances, strangers, that really you see the greatest effects on loneliness as people spend maybe 70 or 80% of their social time with those close ties and 20 to 30% of their time with those weak ties. And so I think this is really important that you absolutely need strangers and coworkers and all these other people in your life. In fact, we see people who have 100% of their social time with friends and family. We said that they actually have higher emotional and social loneliness than those with 70 or 8. So this trade-off of maybe 70-30, 70% with those close friends and family, maybe 30% with those more distal friends and family or acquaintances or coworkers is really the best kind of mix of relationships that you should have. And so I guess I know we're at time. I think 10, and so I understand people will start dropping off. But Pete, is there anything that you want to say?
Yeah, like honestly, I could go on these slides forever, but I think there's so much in there. For me, again, this all comes back to education and helping people understand what it is that we're actually talking about here. When I think about the introvert extrovert question, which is the first question that comes after every presentation, is, you know, we all need human connection. We need to understand how much we need, but we all need it. And we also need to be conscious as to how I can connect with an introvert by saying, let's go have a coffee, versus to an extrovert saying, let's have a street long potluck. And I think that level of consciousness will help us all recognize the role we can play. I think the insight around 3 to 5 close friends, Robin Dunbar's done that research. I know Julianne Holt-Lundstad did some recently. So everybody is aligning on that 3 to 5 number. And I think for young people today on social media, when you think that the average person needs to have 500 friends or 750, or maybe it's 5,000, I don't know what the average is now. I think for all of us, recognizing how many people do I really need in my corner and where is the greatest benefit will really help people as we move forward to say, look, ignore those numbers. Those aren't important. And I think for a lot of us, that can be really important. And then the 2.5 hours per day or 20 hours a week, I think that will be a massive wake-up call to Canadians and people around the world when we think that we ask them to do 20 to 30 minutes of exercise a day, or whatever what is that? It's 6 hours a week. No, I can't remember what it is. Maybe it's 4 hours a week, 3 hours a week. At the end of the day, when you recognize how much social connection we need in order to maintain good happiness, health, longevity, when we put it in these contexts, I think people are going to have a real wake-up call where they say, hey, we really need to be putting some more priority on our social connections. I need to put it in my calendar. My company needs to create those occasions. My community, my family, everywhere we go has an opportunity to be part of the solution to this. But until we all understand it and understand it deeply as to how important it is, I think we continue to struggle to how we fill the void for the human connection that post-pandemic may not be there so easily.
Yeah, I think this is actually, it made me think of this data again from Robin Dunbar, which looks at the average time in like pastoralist or agricultural societies or tribal societies. The average hours is actually 3 hours per day of what people tend to get. And so I think this is really instructive that like the base way that we structure a society, really it seems that the human thing to do is spend, around 3 hours socializing. But we've made ourselves so busy with work and all these other, challenges and tasks and activities that we often have constrained it down to, getting much less than that. And so I think it is, you're right, that some of it's about this interaction of individual choice and setting up the structure and system to be accommodating for that. And so I liked what you said about organizations actually starting to think about, how do I make sure my employees are socially healthy? Not presented here, but in previous research that we did with the 2021 data, is we found the #1 important factor in predicting employee burnout in Canada was the strength and quality of people's relationships. And so if you want employees, for example, to be resilient and to be productive, they need to be healthy. And I think that's a wake-up call to organizations to start to think about, how do I really make sure that the people I work with, that their basic needs are being met. And just as important as food and water and break times to accommodate those things is social connection. It's actually just as important as those sort of things. It's a biological need. And I think it's a big challenge for all of us to think about how we can really facilitate that at work and navigate, I guess, a lot of attitudes that are emerging with regards to work and whether or not workplaces should try to be families, or, I think there's a lot of comments about that out there. And I think we do really need to strategize and think intentionally what we can do about this. Social connection, we've always kind of assumed at a policy level that, that's just going to happen. People are just going to have healthy relationships and lives. But it's actually what we see is, no, the things that you do in your society to structure it are actually shaping that, people's ability to get out there and get the connections that they need. And so as a result, we need intentional we need actually public investments in this. Just as you're investing in other, forms of healthcare, there needs to be societal investments in making decisions about what are we deciding about algorithms when it comes to how they addict young people to using apps and websites. What do we, these have to be intentional decisions that we need to start taking seriously. And I think this work really highlights that.
Yeah, there's a couple questions here, Kiffer, but I'll just say, look, at workplaces where we do a lot of speaking right now, a lot of work educating, empowering, catalyzing workplaces. At the end of the day, we've been very reactive with our healthcare in workplaces. It's usually, hey, when you're sick, we've got the program in place. And I know a lot of business leaders are, can't really fathom, why am I responsible to build social connections for my employees? That's their responsibility. But whether it's while that person's working remotely in their home, or whether it's when they find the opportunity to come together, there is only one option as a business leader, and that's to say, look, if you want to get 110% out of your people, you have to invest in them as people so that they can be happy and healthy and bring them their full selves to work. I was going to do kind of a rough faux end at 1 o'clock, but I think we'll just continue right through the end. There's still lots of people here who want to tune in. So I've got a couple questions here, Kiffer. Fascinating, so important. Have to leave. Recording will be available. It's Stevens here. What insights would you highlight from your research for organizations working on building social connection, or funders, policymakers trying to figure out what they should do about the results?
Yeah, I think that's a great question, and it's going to vary really organization to organization and context to context in a lot of important ways. One of the things we are doing as we develop our Canadian social connection guidelines is to consult with communities and to ask these questions about, what are the barriers to doing this that need to be addressed, or what are the facilitators that need to be addressed? I can tell you the things, even in my research lab, I've got 15 or so people working for me, and thinking about just this, thinking intentionally, how can I get them to connect? How can I make room for that? And so, things like scheduling a 30-minute, setting up a roster so that they, each week they meet with somebody for 30 minutes, in their division or in their research lab, I think is an important way. And they get paid for that 30 minutes, right? They get to take the break and connect. And I think those sorts of things of just intentional programs that connect people to one another and give them space to connect. I think it's like decisions around, what does your lunchroom look like? I think a lot of tech companies have done stuff like this, where they provide food on site, to make sure that people can come together. One of my favorite jobs that I ever had was, somebody just having potluck and food is at one of our, we actually just put in a grant to look at the role that food plays and how organizations can better use food to facilitate social connection and bonding. Because, dating back to the history of all humans, right? Cooking around a fire was the main source of people's social and communal life. And so I think we call that commensality, this coming together to eat. We see incredible, factors associated with, people who do eat together, families that eat together, the strength and resilience that brings. And so there's little things like that, right? It's just making little decisions about, how can I really facilitate social connection and relationship, and make sure that my employees know that that's a priority for our life. Or, when it comes to a policymaker, are we funding those sorts of programs, right? Do we actually invest in things for the sake of social connection and health? Or do we only invest in it if it's got an ulterior concern? A great example of this is, for example, among people living with HIV. There were a lot of community services developed in response to the HIV pandemic to address, things like medication adherence and to support people in poverty. But as soon as effective treatments came about, really the government divested. They stopped funding all of those programs. And I think what we've seen is an incredible kind of crippling of people's social lives and social connections. And I think it's because our policies were not person-centered. They did not recognize that a person is more than just the ICD codes in their patient chart, or they're more than just the, just the medical condition that you're diagnosing them with. but they actually have all this other stuff going on in their lives that is fundamentally tied up to their relationships and their social life. And if you don't have that working, then whatever else you care about probably isn't going to work either. And so, so for policymakers, I think it's mostly about recognizing that, yeah, this is something that legitimately should be funded in and of its own. And I think we've had a real struggle in Canada since the 70s and 80s with wanting to fund those sorts of things. Government does not simply invest enough money into it. They do these tokenistic, little community grants that are these often small grants, but it's often just not enough. And I think that we spend too much money on therapists and medical care and not enough money relatively on prevention, right? If you think about your health, about 20% of your health, for example, is due to your access to medical care and medical treatments. The other 80% is about prevention. And I think dollar for dollar, the cost of prevention is much more cost effective. And I think that's where we need to start to move society, is stop being reactive to all of our problems and think about that we actually just need to build healthy and happy communities to prevent those problems.
You go, Kiffer Card. I could listen to you for hours on that one. And I just throw on top of everything that Kiffer said, Stephen, as far as I'm concerned, because we've never educated people on this information, this is nobody's fault. I say that, almost helplessly. It's nobody's fault that we are where we are. We went through a global pandemic. We didn't understand the value of our human connections. We took them for granted pre-pandemic. So I believe the starting point as part of the policy, as part of the government changes, is actually educating people on these fundamentals. And that's what the guidelines will be able to do. I can tell you, when I started in 2016, I couldn't get a conversation with a business leader, I still struggle to get conversations with political leaders because they want to live in the crisis. We spend $350 billion a year on healthcare in this country. And to Kiffer's point, we probably spend less than 0.1% of that money on prevention. The healthcare system is bursting at the seams. Programs are desperate for money. But as an article in the Globe shared 6 months ago, and I think that was a follow-up to an article from years ago, hey, community healthcare is certainly one of the solutions to how do we change the system. And the other solution that we can start today is called prevention. And it's, social connection. We know about exercise, eating well, everything we've talked about today, but we haven't spent any time educating people on this. So, whether it's a community leader, whether it's a business leader, whether it's a classroom, just taking the time to walk people through the guidelines, through this information that we're doing as part of the Canadian Social Connection Survey, to me, is the first step in changing people's perspective on how we could be part of the solution to the disconnected world that's having so many negative effects. And I posted, I think today or yesterday, on the random acts of violence, there's another article out of the US on the connection between loneliness and mass shootings. This is not just a health and well-being issue. This is a societal issue that impacts so much of what we deal with each and every day in our lives. And when we can help people connect all those dots, I think most people will be willing to step up and be part of the solution. But as long as we don't know the information, as long as we don't know, and I noticed that you said, what things would we suggest? We do a program called Heads Up at campuses. Kiffer's working on another grant that we're trying to develop that even further. Campuses have an amazing program, from intramurals to clubs to all that, but maybe it's because students don't understand why they should be part of that. Yes, you may love chess, but there might be other reasons to do that as well. And so I think all of this is part of educating society more broadly as to how important human connection is and what we can all do it, because there's lots of activities out there that we can point people towards, but until they understand the why, I'm a big Simon Sinek fan, many of us may not take that step.
Yeah, I agree, Pete. I think that is the biggest challenge, is that I put it into the link about specific interventions. We did a scoping review of interventions related to loneliness, and there are a lot of individual programs that can be systematized. One of the most promising, one of the ones catching the most traction right now, is called social prescribing, in which you actually create link navigators who are like basically social workers that help connect individuals to community assets. And the classic referral process is you go meet with your doctor identifies you as needing this support, and then they refer you to these link navigators. That intervention, just like all interventions, in my opinion, will struggle to actually have impact until people really understand the importance of social connection in their health and well-being, until governments understand that you need to invest in that to get the health gains that you're looking for and that they're cost effective. Because I think Pete's right, and I think this has been GenWell's message for the past 6 years, is that we fundamentally, if you don't prioritize it, it's not going to really work. And so I think that's really the challenge, is really that convincing piece of people. I think it's different though than, because when I talk about convincing people or educating people or health promotion, public health has in many ways moved beyond health promotion, and that it's not quite the powerhouse that it used to be. When we created participation or the food guideline or the nutrition or exercise guidelines, right? All of those sort of things really relied on this. And I think one of the reason people struggled with those campaigns is because the biological drivers for nutrition and exercise work against you. Biologically, you want to conserve energy and you want to store fat and you want to eat things that will get you, that. And so you really got a lot of these biological processes work against you. I think social connection is different because you've actually got the biological processes working in your direction once you start. Once you start building healthy relationships, you'll want to spend more time doing them. And it is just becoming that initial maladaptive cognition that people have with regards to social life. And so is what we see in interventions that is most effective, and this is consistent across studies, is that interventions that address that, what we call maladaptive social cognition. So they help people to reevaluate the importance and value and how to have social relationships. And oftentimes a big barrier to social relationships is self-esteem, in that you think other people don't like me when we interact, and therefore I don't enjoy my social interactions. And is what we see is that interventions that address that core sense of self and sense of relationship to others, those tend to be the most effective and cost effective. And so we're actually, as Pete mentioned, developing the Heads Up campaign, which is actually working, starting in college students and university students, to develop out modules that can kind of be used kind of like what are those other mental health apps, like, I can't think of anything, like Calm and, these other things. We're trying to develop an app like that to help people improve their social well-being and social life. And we're starting with college and post-secondary students through the Heads Up campaign, and we'll then take it and adapt it for younger and older populations, if we can get funding to do that. So I think that's some of that's all this kind of first step stuff, but that interventions link that I put in the chat has a lot of other specific interventions that, I think show promise, at least.
That's awesome, Kiffer. All right, I don't see any other questions, so I'm going to pause for 30 seconds, see if anybody else wants to throw in something. But first and foremost, I want to thank everybody who joined us today to be part of the conversation, to hear the latest results from the Canadian Social Connection Survey. I think it's been repeated multiple times that we don't know this information. And in most cases, when we say we don't know this information, we think, oh, it's our young people who don't know it. But I would suggest to you, our leaders don't know it. In many cases, our healthcare community doesn't know it. Certainly a part of social prescribing is actually educating the healthcare community on the power of human connection. But I think across organizations, community groups, classrooms, professors, administrators, in colleges and universities, in high schools, because we've never educated people, we don't have the benefit of 50 years of knowledge on exercise, where when an exercise program in a school is canceled, people are up in arms that we canceled that exercise program, which I fully agree with. The same with, creative arts of music and other things. All of these things are important for us to grow as human beings. But we're behind the 8 ball right now. We just had 2.5. Now I guess we're on 3 years of a global pandemic. We know that people aren't back out and connecting with other people. We need to help people understand this. We need to help empower them to take action themselves. And most importantly, we need to catalyze it, whether it's, you know, in any one of those circumstances, because we cannot let people, you know, stay isolated alone. We've seen it in seniors. We've seen the negative, and we're seeing the ongoing negative implications in our young. And frankly, you know, it extends across the life stages that it impacts all of us. So with that, Kiffer, any final thoughts before we wrap? Because I don't think anybody else has thrown a question in.
Somebody asked us a question about volunteers, and
sorry.
I think I'll just say that literally during this meeting, I just got an email that's saying one of our projects related to volunteers was funded. So you know, that is something that we're really interested in and working on, because I think that, like, really at the heart of it, you know, we need to return to this emphasis on pro-social and civic life, and that actually investing in those things is really critical. And I think that we haven't really done that for the past couple decades. And I think that that's we need to build communities. You know, we need to pour money into Indigenous and ACB and other LGBTQ communities, and then also communities and neighborhoods across the general population. And that until we make those investments, we're really going to struggle to see a lot of positive change. And so, you know, I think, you know, over the course of the, you know, next couple of years, we'll really work to focus on that. Like, how do you build a pro-social, you know, where people want to invest in this? And I think that's one of the challenges, because there's so much competing for our attention, right? There's many problems that we're facing as a society. But I do think that social connection is a really good, promising way to address most of them, right? If we think of political divide and social media, right, and you know, conflict, all of that can be helped by creating a more connected society in which people have more social trust, more cohesion. And so this is what we're talking about here. I think is the scale is huge, and that makes it seem impossible. But I think through people's participation, engagement, you know, both corporate, educational institutions, all the partners who are engaging in this, it's really going to require a whole of society response. And you know, I just want to express my thanks to Pete for you know, working with my research team on this project, and helping us get out the word and to raise awareness, because that's really what's going to create impact. It's not the research. You know, it's easy to bring money in for research. It's hard to bring money in for intervention work like Pete's. But yet I think that that's really the critical critical piece that's missing a lot. So thank you, Pete, for all your hard work and for hosting this webinar. And it's an honor to be able to share our work with GenWell and with the rest of Canada.
You are the man, Kiffer Card. Thank you to you for all the work you do, for leading that team of amazing young people out there at Simon Fraser that are working on it. Again, thanks to everybody. Stephen, you asked how to follow for the results. You can follow the GenWell Project on all of our social channels. Kiffer, I think you're on Twitter with the Canadian Alliance for Social Connection and Health. You can follow them there. But trust me, Stephen, when we have some results, we will be letting the world know, in hopes of inspiring more engagement, more knowledge, more activity around social connection and social health. So thanks to everybody for being a part of this. And I see a lot of familiar names of people who I know are fully engaged in this. And I hope this gives you some ideas on how you can take this information and use it in the context that you work in to make the world a happier and healthier place, one face-to-face conversation at a time. So have an amazing afternoon. And the recording for this, other than some edits at the front of me rambling before I came on as I was practicing my intro, should be out in the next 24, 48 hours. So we'll get it as quickly as possible. But thank you to everybody for being a part.